Of course, then there's the breast augmentation, and it's one of the top procedures that is done not just nationwide, but worldwide.
Oh, wow.
So there are two main approaches to breast augmentation. One is with implants, with either saline or the saltwater implants for those who still want to avoid silicone implants, but the more popular are the silicone gel-filled implants.
Is there a reason to still avoid silicone? Because my understanding
No,
is...
the FDA still approves silicone implants for both reconstruction and breast augmentation, cosmetic purposes. So most women appreciate the gel-filled implants, and they tell me that they feel more real.
Is there still debate on if you go through like the belly button or underneath, or I know sometimes through the areola? Is there a way, or is that again a custom based on the patient in front of you?
That depends on your physician. There are some who like to do it through the armpits or through the areola. I am the one that likes to go underneath the breast. I feel that it gives me the best approach. I can see the anatomy better. I can get the implants placed better. And it tends to be the more popular way of doing breast augmentation. Especially with the gel implants, you need a little bit longer incision, and under the breast in the natural crease is usually the best way to go.
Then you don't risk any kind of nipple desensitization, right? Because that's something when it may or may not happen, right?
There's always a risk. There's always a risk. But in my hands, I feel that it's the safest way so that I can decrease the potential for losing nipple sensation.
Right.
I think it's very important, and I try to keep it.
What about above versus below the muscle? Do you have a preference or a recommendation?
Above the muscle are for people who have substantial breast tissue to begin with. Typically, most of them will put below the muscle, and often that will do two things. One, you can hide the implant a little better so you don't see rippling. But two, it also helps with what we call capsular contracture. And the capsular contracture is where the scarring around the implant wants to get firm. And with it being under the muscle and the muscle essentially massaging the implant on a daily basis just with movement of the arms, helps to decrease the capsular contracture.
What about different sizes and maybe different positions of the areola? Is that something you're able to help them with? I mean, obviously the sizing
not with the breast augmentation. With the breast augmentation, you put the implant in, and if it's an enlarged breast, the nipple or the areola is just changed from the implant.
Is there something you can do for helping misshaped or other sizes?
That's where you get into the mastopexy or the breast lift, and that is repositioning the nipple. That's usually for somebody who feels that their breasts have dropped and they want them lifted, and that's the mastopexy.
Is it ever a combination, or is it usually one or the other?
Some will do combinations where they'll put an implant at the same time as a breast lift.